In recognition of Alopecia Awareness Month, Dr. Hyacinth Oates joined CVM at Sunrise to shed light on the science, causes, and emotional impact of hair loss. From traction alopecia in children to male pattern thinning, genetics, lifestyle triggers, and available treatments, this conversation offers knowledge, hope, and practical steps for those affected.
We're back here inside the Sunrise Studio, coming to you live from 69 Constant Spring Road here in Kingston, Jamaica. Good morning to you, wherever you are tuning in, however you are tuning in. We thank you for rising with us. Well, guess what? September, it marks Alopecia Awareness Month. I bet you didn't know they had one of those. And today we'll be shining the spotlight on the often misunderstood condition that affects millions worldwide. Zooming in this morning is Dr. Hyacinth Oates, a certified trichologist, to break down the science of hair and scalp health and to help us explain the different types of alopecia and address the emotional impact of hair loss, from early signs to treatment options and confidence boosting strategies. Welcome, Doc. How are you?
I am fine, thank you.
Good morning, Doc.
So happy to.
Yes,
well,
good
first of
morning.
all, I wasn't aware that you had a month dedicated to boosting awareness. Very good.
Alopecia, yeah.
Yes, we have a month for that, and it was very necessary for us to pinpoint a certain time when we can actually focus on this very important topic.
For how long has it been celebrated, Doc? And the awareness?
Well, alopecia, on a whole, as a profession, is in the system for over 100 years.
Oh, wow.
So our alopecia month is like 30 years old, but it's just that it is now being brought to the Caribbean. I brought it in to Jamaica and then to the Caribbean because it was important for us to be able to answer some of these questions that customers, we call them patients now, were asking, and we were just not able to pinpoint the different things that would trigger some of these disorders that we were noticing in the salon. And this is where we're coming out of cosmetology. But now you have trichologists who are not cosmetologists. They are doctors, they are nurses, and other areas of the sciences of the body that is really paying attention to some of these psychological, traumatizing effect of people losing hair, both females, males, and children.
Yeah.
Let me ask you the question this way, because there are so many things there are so many avenues that we could go into trying to understand what alopecia is.
Right.
What is it not? Let me ask it that way.
Well, alopecia, because there are so many different forms of alopecia.
Right.
Alopecia is a broad umbrella under which hair loss falls. So whether it is alopecia areata, alopecia universalis, traction alopecia, which of course you know that in this country I did a research on it, and it was the most traumatic
Prevalent.
alopecia that we were experiencing because it is, most of the time, it is generated through how we actually style our hair.
Yes.
So we cause this
The wigs.
ourselves.
Yep.
Right. Oh,
Lace
but not
wig,
just
man.
wigs. No, extensions.
Yes.
And remember now, children develop these conditions. Some of these conditions are developed from parents pulling on children's hair. 1 year old, 2 year olds going to school, and it has to be pulled so tightly. And then, of course, they had like the little balls on it just to make the baby look pretty.
The bubbles,
But
yes.
yes, but they're
Like
traumatizing.
this obsession with catching up the hair,
Hair.
and in order to catch it up, you have to pull it back tight, and it put
And
pressure
you're
on.
using the right term there. The catch-up is a problem.
But let
That's
me
where
ask
the
this, Doc.
tension is.
But let me ask
Sorry?
this though. Let me just ask this. Because sometimes too as parents, especially mommies with daughters, you know, you want to catch them. Okay, you want it to look nice. But you're making an effort not to make it tight. But then it don't seem tight. But then, you know, a trichologist is saying, but no, Miss Kitty, that is tight. How do you know when too tight is tight?
Well, let me tell you something now. We have different types and textures of hair.
Yes.
So you would have a baby, well, a little girl, a 1 year or a 2 year old, with the type of hair that look, people used to call them, when you mix with Chinese or you mix with Indian,
Yes.
the hair comes out with a wave pattern.
Yes.
Now, when you catch up that type of hair, you don't really have to put as much pressure on it because the hair looks smooth
Right.
already. Right. And of course, everybody wants the hair to look smooth and straight. And remember now that all of us, most of us, our fathers are nigger men with curly hair.
Yeah.
So when you get the little knotty hair baby, overly curly hair baby, you're going to pull that hair to death, trying to get that hair to look smooth and shiny. And when you do that now, you are pulling that hair out of its phase. You're actually pulling that hair through the scalp away from the life that the hair is attached to.
So that's what you call traction
alopecia.
alopecia.
That is,
Yes.
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 Oh.
So that traction alopecia, as I call it, is one of the symptoms of being a hot girl, right? Yeah, we tend not to
Well,
have
yes.
any big toe
You
and you don't have any
edges.
hairline, you don't have
Yeah.
any edges
Yeah.
because of the wig and the glue and the ketchup and so on.
I
so the
am
pressure.
telling you.
But let me just ask this though, Doc, because men are also, you know, suffer from alopecia. We've seen in
yes.
recent times where many of our men are going to, for example, Turkey to get hair transplant. Let us talk about some of the
boy.
solutions out there, because yes, we see that the hairline is gone with the traction alopecia and the other types are there.
But
the men
sometimes
are,
it's not. You're not doing anything.
yeah, sometimes it's genetic.
Yeah, it's genetic.
Yeah.
Well, I know for me, there was no hope for me. I gave up very early. But
It's
then,
in your family?
Yeah.
Okay.
But the challenge is that somebody may be selling you hope in a bottle, like one oil where you're going to put by your head, and it never... It,
Yes.
Yeah. Do these
Yes,
oils work,
yes.
Doc, or is
If
it
you
that you
just
have
have
to go?
alopecia, it's just not going to change.
But listen to me now. We're talking about, when we talk about men and hair loss, you have to remember that these are hormonal issues. Right. There's a research that was released out of China. And one of the triggers for male pattern thinning, thinning,
Oh.
please, thinning, before it gets to the point where you actually is noticing that there is a loss of hair, it actually goes through a thinning process. If you get that process early, you can do something to slow the process down. Because normally, hold on, normally that thinning can start from about, as if it's genetic predisposed, it can start from as early as age 17.
Oh, wow.
Right. No. No, they have found in their research that men, young boys who are caught up on sugar, sweet drinks, anything to do with sugar, compound the problem and can expedite it. So now we have to make sure that the young men who are experiencing a thinning, it's not lost yet, because you don't just lose the hair. If you're going to lose the hair, then you're into alopecia areata. But if you are going to be reacting to a genetic predisposition, that means it's already in the family and you're inheriting it, then it is going through a thinning process. But listen to this now. Our fashion, the way that the men are wearing their hair, where they outline, the thinning normally starts on the edges. So you will notice that the hair gradually becomes lighter. Now, when they're outlining the hair, when they get the hair cut and they're outlining, the barber would press that shear on the scalp and move it back. So gradually,
Just
Move back.
that hair becomes thinner as you going back into the crown area. We don't want that. We don't. That is not to be done. When you are thinning, you now have to seek advice and treatment, meaning that we have to look at what's going on with your body and your genes, and because sometimes the body emphasizes the problem when it comes to the male pattern hair loss. But it's basically hormonal.
But what
So,
about women, though? Because women and their hair, so much of their identity growing up as a girl is tied to their hair. Maybe as men, we let it go. We're not as tied to
And then
it.
you know, I don't
No,
necessarily agree.
but
A lot of men
please.
too have
Yes,
a lot
yes.
of
Please.
your man
true,
with the
that
men
is
as
fair.
well.
But it is more acceptable. A man can accept when his hair is going, but there
And
are
just
many
shave it
women.
off.
There are exactly, but there are many women who maybe in the middle it's thinning, and it is almost an existential crisis
Yes.
as well.
Yeah.
I mean,
it becomes a psychological
Yes.
problem now.
Yes.
Because really and truly, the way you look in
Affects your
terms
mental
of your
health.
hair impacts the whole of your attitude, the way you
Yes.
look at life, the way you see yourself through a man's eye, all of that. It is trauma, in truth, when a woman loses her hair.
Yeah.
And,
So
and I am telling you, when you are losing your hair, you are stressed, so you release cortisol hormone
Yes.
in the body, which only makes it worse.
Yeah. Well,
Right.
because we have to wrap now, but I know a lot of persons are watching who may be going through alopecia, whichever form it is. In Jamaica, earlier I mentioned persons going to places like Turkey to get hair transplant and all of those things. What in Jamaica do we have, or where rather, do we have to go to get some help so that, yes, your hair is thinning or your hair is bald or you're losing hair, but there is hope for you? What can persons do to restore their hair?
Well, the first thing you need to understand is that a hair specialist is the person who really focus on anything to do with hair. You can also go to a dermatologist. Her specialty is skin. But with the trichologist, it's both. It's hair and skin. Not only that, we have to look at the body. We cannot do anything without looking at the body. So if you start showing signs, we can pick up on things such as people are talking about hair transplantation, right? And they go to Turkey. It does not always work. Why? Because it come in like sowing grass in the body. If the soil is not at a point where it's not fed. It's right. It's not the right
Fertile.
environment it's not fertile for maintaining hair. Then you put you're going to slice a piece of that scalp. You're going to pick out each follicle, each strand of hair. You're going to place it in a follicle that is not healthy. So what are you going to get? Hair that is less than healthy, and most times it does not grow back. So, it's not just going somewhere and get it done, the whole process. You have to do a blood test. That is a must, because we need to know if the environment for that procedure is conducive. What if you're nutritionally deficient? You don't have any zinc, your sulfur is low, copper is low. All of these are components that contributes to healthy hair. You don't sleep well at night. If you don't sleep well, then the cells cannot repair themselves. Good sleep is important.
Right,
It is.
definitely.
There is just so much to it, that it is not just what meets the eye that you look at somebody. But even if they come into the clinic, we have people coming into the clinic. And Lord, yes, you know, the hair is here. We have a condition that I don't know if you would remember it. We used to call it hot comb syndrome. That is when people are, white people doing research. They're not doing it on black people. They're doing it on white people, and we adopt. But they used to call it, because they didn't understand it. When you press the hair with oil, they used to say that you get the hair loss, you scar the follicle, because the hot oil runs down the shaft of the hair and scars the follicle. Now, about 3 years ago, we now know that we have a condition that we call CCCA, Central Centrifugal Cicatricial Alopecia. And this is now identified in Africa, that it is a mutated gene in African descendant women. And now they have found out that the men are actually responding to this condition. If you catch that where the middle of the head goes bald, the hair breaks very low to the scalp, and then it bald, and it spreads, and you can become bald with that condition.
Wow.
But it starts from a little dot up in the top of the head, and it spreads gradually. That is why you have to come into the trichologist in order to identify what is causing your particular problem.
Doc, you sound very passionate about this topic. I am very knowledgeable about it, and we're very happy that you're sharing with us this morning, and you have definitely enlightened our darkness. And here it is, I got to tell you, absolutely amazing. And I want to thank you so much for sharing, Doc. Are you on social media perchance?
Oh, yes. Yes, we are.
Where can we find you?
We are
on YouTube.
We are at 16 Chelsea Avenue. It's the TrichoTherapy Hair Centre.
Yes.
And we are now at 16 Chelsea Avenue at the Summit House.
Oh, I know where that is. The Summit.
Okay.
Right.
Right.
No problem, Doc. Well, we'll come and see you. But thank you for your work, and I wish you all the best.
All right.
You are quite welcome, and thank you for having me.
You're most welcome. Our guest, very knowledgeable, and some like people love them job and know them work, you know what I mean? And sounding very knowledgeable. I really do like that. Dr. Hyacinth Oates, trichologist at TrichoTherapy Hair Centre.
Yeah, you can find them on YouTube at TrichoTherapy Hair Centre.
And you know, Dennis, it's a lot, you know, because our hair is our crown, you know, and so it really does go a far way. And I know somebody had an aha moment right now, because it's like you feel like your hair falling out and I have to just live with it and done. Well, guess what? You can go check it out, all right?
That was Dr. Hyacinth Oates from TrichoTherapy Hair Centre, reminding us that alopecia is more than just hair loss. It's about health, confidence, and hope. If you'd like to learn more or book a consultation, you can find TrichoTherapy Hair Centre at the Summit, 16 Chelsea Avenue in New Kingston, or visit trichohaircenter.com for more resources and support.